Okay, we'll wait a couple minutes for folks to get situated and then we can get ourselves started. All right, let's get started, and people will continue to trickle in as we kick off here. But welcome everyone. We're excited to have you guys on another one of our webinars. Today's topic is maximizing impact, leveraging SurveyVista for operational excellence and strategic growth. Got a couple of friends with us here from the Happy Mama team. Quick agenda. We'll start with a round of introductions. We'll tell just sort of at a high level what SurveyVista is. There may be some people here who aren't quite familiar with the product itself, so I'll do a quick high level overview, and then we'll get into really what this webinar is all about, which is a conversation with the Reach Healthcare team and their success story with SurveyVista. And then after we've heard from that team, we'll do sort of a quick presentation on why people choose SurveyVista and do just a quick product demo so everybody can get sort of that peek under the hood, which we love. And then at the end, we'll save time for Q&A. So if there are questions as we go through the process here, I believe on the webinar, there's a chat. You can put questions in the chat. There's also a dedicated Q&A function, and we're able to use that as well. So wherever you have questions, put them in as we go through the process here, and then we'll make sure to get to those questions at the end. But let's start with just a quick round of introductions. I'll start on my side. My name's Chase Carter. I'm the Director of Sales here at SurveyVista, and we'll be sort of the host for this event. And then we've got a couple folks with us from the Reach team, so I'll hand it over to Fran if you want to introduce yourself.
Thank you so much, Chase. I'm so excited to be here today. I am Fran Ayalasomayajula. I am the founder and president of Reach Healthcare, which as part of Reach Healthcare, one of our main pillars is known as Happy Mama. And I'm excited to be able to tell you more about that just a little bit, but very honored to be here today.
Thanks, Fran. Nargees, you want to introduce yourself?
Yeah, thank you, Chase. My name is Nargees Mahammad, and I work as a system administrator at Reach Healthcare, and nice to be here.
Yeah, thanks so much for joining, and we really appreciate you sharing your story and everything that's happened with SurveyVista. We're really excited to have you guys here with us.
Yeah, sure.
Awesome. I'm just going to start with a quick overview of what SurveyVista is. There may be some Fran fans out there in the audience who are watching this and wondering what exactly SurveyVista is. So we'll start at just a very high level. SurveyVista is a customer feedback and data collection platform, and we are built specifically for Salesforce. We're actually a Salesforce application, which means if you're using Salesforce and you've sort of decided that's going to be my single source of truth, SurveyVista is a really effortless way to build surveys and forms so that you can ultimately capture a bunch of data from your customer base and integrate that seamlessly into your CRM. And we've got a bunch of customization options that allow this tool to be really scalable across a wide range of different use cases in an organization. We're going to hear about how the Reach team does that today. But ultimately, we are, anytime you need feedback and you want that data to live inside of Salesforce, SurveyVista becomes a great partnership for that. And as I mentioned, because it's a really flexible platform, we support a wide range of different use cases. So everything from surveys, and whether that's customer satisfaction or market research or a net promoter score, your traditional surveys, we support all of those use cases. We also support some more advanced use cases, things like forms. Think about applications, think about referrals, think about web to form, web to case, web to contact, lots of different applications in the form world. And then we support even some really advanced use case, things like assessments and quizzes, the ability to basically send a survey and have that survey be scored or graded. So no matter how you're collecting data, SurveyVista becomes a really great partner for that. And that means that across all of the different teams within an organization, all of your different departments, if they have a need to gather feedback, which they do, then SurveyVista can support all of those needs. So it's a really scalable tool. And ultimately, because of this, we really help you to maximize the impact or maximize the ROI you get from your data. Because one, it's incredibly scalable, so you'll be capturing data across the entire customer journey. So whether you're a renewals business and you want to ultimately sort of protect revenue, or whether you want to maximize new revenue by creating better customer experiences, whether you're trying to collect data to ultimately change the way you interact with customers, we'll hear a lot from the team today about how they think about using feedback as a way to drive operational efficiency. That's sort of the theme of this. And also just boost engagement. Better surveys create better customer engagement, create better brand loyalty. So there's a lot of impacts that can be drawn from just one tool. But let's get into what we're sort of here for, which is the Reach Healthcare success story with SurveyVista. And I think maybe a great place to start. We sort of did the overview of what SurveyVista is. I think maybe, Fran, if you could sort of inform the audience of what Reach Healthcare is, and we'll use that as a jumping off point.
Yeah, thank you for that. So Reach Healthcare, we are a 501c3 non-for-profit organization. We're a global social impact organization, in fact. And with that, our real focus is on research, education, thought leadership, and innovation. So we take our findings, the research that we conduct, and we actually utilize those findings to develop new innovations within industry. And as a mission, we're focused on improving the overall experience of healthcare for both patients as well as for providers, and offering to payer organizations innovative solutions for improving outcomes. Now, with that our areas of focus underneath, if you will, underneath that umbrella, where we've really began to target, beginning as far back as 2016 when we were established, was to begin to support older adult populations within the community. We had since have grown based on our research areas to also encompass other areas of vital need of vulnerable populations, one of which is working in the maternal health space with both women who are either pregnant, laboring and delivering, or in postpartum. And that particular maternal health program is known as Happy Mama. It's one of our youngest and yet one of our fastest growing initiatives.
That's awesome, Fran.
Thanks.
And then sort of weaving this into this conversation with SurveyVista, I think I'd be curious a little bit sort of like when you initially were reaching out for this tool, like what sorts of problems were you solving? Like where was the organization at when you were evaluating SurveyVista, and what were you looking to solve for ultimately?
Well, essentially, when we first began with it, we were actually not, you would think, oh, we were looking at it from a research angle, but we weren't. We were actually trying to figure out ways of capturing information for our clients who are enrollees into our Happy Mama program. So to kind of make a little bit more sense, I'll start by just sharing, okay, well, what is Happy Mama exactly? So Happy Mama is a tech-enabled full spectrum doula practice. What that is that we support women or birthing individuals as early as 3 months preconception, particularly those who are going through fertility treatment, all the way to 12 months postpartum. So that is up until the baby is 12 months years of age. And so with that, you can imagine there's a lot of information that we have to manage. I mean, look at it. Just in San Diego County alone, there's over 40,000 births in a year. Now, of course, we're not positioned to cover those, but we're making our way. But what it means is that there's a lot of dynamic interaction when you're trying to support someone who is pregnant. And so the data that we needed to capture, we need to figure out a way to do it seamlessly and effortlessly. Now, there might be some people that say, oh, well, why aren't you just using an EHR? Well, one of the things I didn't say when I introduced myself is that I'm actually 30 years in healthcare as an epidemiologist and public health professional. And much of the research that we have done within Reach Healthcare, we know from, again, improving the overall experience for healthcare for both patients as well as for providers. We know that one of the contributors to burnout for clinicians is, in fact, charting and using EHRs. And because we work with pregnant individuals, our propensity towards burnout is even greater. So we had to figure out a way that we could manage collecting the data we needed, because we're a nonprofit, and the only way that we'll receive our funding is if we can show that we are actually serving communities, serving families, is that we had to figure out a way to do it in a way that was simple, that was user friendly. So at first we looked, I think it was not exhaustive, but it was exhausting to look at dozens, literally dozens of EHR programs. And I thought, okay, we had to select one, and we do have a back-end EHR that we utilize, but we don't use it as the front end for the interface with our doulas. Unique to our business, these individuals actually have, in terms of digital literacy, from a consumer perspective, sure, they might be text messaging, but that actually from a business perspective doesn't mean that they are tech savvy and that they're comfortable interfacing with what would be an elaborate EHR. So that was out. And then we said, okay, well, how do we balance this? We've got to have our data within the EHR, which I'm pleased to say that we do, but we also have a lot of other elements, because doulas are non-clinical, or they're not clinicians. We're non-clinical in the work that we do. We have to have an environment that's more appropriate for them, that doesn't require a complete overhaul of an EHR. So we moved over and looked at other environments. CRMs became natural choice, and we elected to go with Salesforce. When we moved into Salesforce is awesome. It's a great platform, but equal to its cousin, if you will, the electronic medical record, it is overwhelming when it comes to data entry. It wouldn't work. So this is where Nargees and I came together. And I said, Nargees, look, we need to collect this data, and we need to do it in a way that's simple and easy for our doulas to be able to do. How can we create an interface that is seamless, right? Makes for what we call in tech frictionless, right? How can we make a frictionless interface for our users so that we're able to capture the data we need, and at the same time enable our staff to feel good about the tools that they're using? So we actually did a comparison to a lot of applications, and honestly, I mean, there's some top names that are out there, some top brands, quote unquote. They're known because they have good marketing, but it doesn't mean that they're the best. Because for us, there were some criteria that we were looking for. So this is kind of where we began. And then in that, Nargees said, hey, we can look at A, B, and C. I was like, well, I'm already using this one over here, and it's out. And then I said, well, tell me more about these others. And actually, every one she told me, I was like, I don't know about that system. What was my attitude? And so I kept drilling. Nargees, I don't know if you even remember some of the comments I made to you. Do you remember my remark to you about SurveyVista, when you were like, hey, why don't we look at SurveyVista?
Yes, Fran, I do remember that under ABC, actually C was SurveyVista when we told you, but we were using already SurveyVista as A in my previous work, and then we wanted to give you options to choose the best. That's why we gave you other options, A, B, C. And then when I told you about SurveyVista, you just made that one phone call, and then you were satisfied, and you just took it. I'm happy you took it.
Yeah, but there were some reasons, Chase, for that. I mean, it wasn't just because it was there were lots of elements that drove us to it, but that was kind of the process that we went through. There was some rigor, and I was very explicit with the team of some of the things. I wanted flexibility. I wanted it to be a tool that our developers could easily pick up as well. If they needed to make modifications, that they were able to go into the system and be able to make those modifications. Also, though, that we also wouldn't be handicapped, if you will, we wouldn't be held down by only being able to depend on the tech team to support us. That was also important too, right? It was also user friendly for other members of our team to be able to be cross-trained if necessary. All of these were aspects. And of course, like I mentioned, we were using Salesforce, so it had to be integratable with Salesforce. And when Nargees was like, well, this was native, I was like, what? Like that was a thing. I was like, I don't get that. How is that possible that it's native to this tool? And so it was a very interesting experience that we went through. Very eye-opening.
Yeah, I think what's so interesting to me about this is obviously, well, a lot of people come to us and they say, I've been told to go find a survey tool. Show me your survey tool. And you have this very interesting perspective about how this technology fits into your overall sort of business, which I think is really fascinating in that it is a survey tool in the fact that you need to capture data. You're mentioning, you're a registered nonprofit. You need to be able to show that you're impacting communities in order to receive funding. And so that might be considered more of a traditional survey, right? We're trying to measure outcomes with the tool. But I think what's so interesting is you have this other audience, this internal audience where ultimately you're trying to cut down on the amount of burnout, make it easier for people to basically interact with these systems, these EHRs and CRMs, and you're using SurveyVista for that, which I think is so interesting. And I would love for you to talk a little bit about sort of how you think about this tool, this idea of operational efficiency came from you. And so tell us sort of a little bit about what operational efficiency means to you and how sort of technology enables that.
Well, first and foremost, I mean, it begins with the cost effectiveness of a tool, right? And that comes out of maximum utilization.
Mm.
So if I were just I mean, you showed that slide at the beginning that showed like three very separate areas, right? And you acknowledged the flexibility in terms of use cases. For us, we equally did the same. It's like, hey, from an enterprise perspective, how can we leverage before we go to look at anything else? What are the tools that we already have in-house that can solve the problems that we're having, right? And so that was really key for us. So on the one end, you can kind of look at it from sort of two levels, if you will. One is broadly from an enterprise perspective, where we've had challenges in human resources and our, not just on the hiring and recruiting side, like accepting applications, but also in terms of like getting insights from our employees on benefits, right? We have a thing called our Wellness Wednesdays. We came up with Wellness Wednesday because it came out of the demand of our employees. We use it to drive the benefits that we decided to offer as well. So there's those elements of it. But then there are other things like our inventory management, which is really key because we're working in the field and there's equipment and material that not only touches our client facing and our community facing activities, but it also impacts our marketing organization, right? Even where equipment that we would use if we were going to be exhibiting at a local health fair or what have you. So we use it for our inventory management. Could we have gone out and got an inventory management tool? Yeah, we could have, but number one, it would have strained us. And number two, why would I when I have a tool that's so efficient that can do that for us? We also started using it as well for the onboarding process. That became very key to us. And so there's just this overarching. When I look at our overall enterprise, the only area perhaps at the moment where I haven't utilized it is in finance. And I'm sure if you give me long enough, I'll figure out a way within our financial management that it would also be applicable, to be honest. Just give me a couple of days. Nargees knows how I roll, and that would probably end up happening. But then it came down to from a programmatic perspective, right? The programs, and I mentioned that Happy Mama is one of it's our premier program that we have amongst all of them. It's a star, and with that, there's so many dynamic pieces that again, everything going from lead generation. So however someone interacts with us, they come through the SurveyVista tool. And their response then triggers it's like a tree, right? It's a branching that's a effect, if you will, because they'll come in, the tool that's being utilized to identify them is SurveyVista. The subsequent backend systems for that then are all driven through an interface of SurveyVista and Salesforce, and we're driving our communications, our responses. And it's not just as simple as to say something like, oh, you can, thank you for contacting us, and that's coming out of Salesforce. No, it goes all the way so much more elaborate to even our inbound and outbound referral system. In
Mm,
fact, our referral system is so dynamic. It has made the difference in our organization as a nonprofit being chosen by some of the leading payer organizations to collaborate with and to provide referrals. So when they have at-risk members, they're sending those at-risk members to us. And repeatedly, what I have heard them comment on is one of the reasons why they love working with us is because of the referral system that we have in place. If you want to know what that referral looks like, you can actually go to our website, happymama.global. And when you go to happymama.global, click on inbound referral. And you go to inbound referrals, and what you're interfacing with is SurveyVista. It's
mm,
eloquent, it's well laid out, it's simple. And once somebody is entering in that information, that then launches a series of chains of reactions. And here's why the client loves it. We use that to create a work stream, right? A wraparound, so that the referee knows, I should say the referrer rather, the referrer knows that there's been confirmation that that we have received their information. The individual, the high risk member that's been sent to us, receives notifications. Our doulas and our schedulers receive notification, and then everything else triages from that. But it's, again, the use of that tool, maximizing it, that allows us to be able to do it. And all of the touch points I mentioned in terms of the users, the user profiles, each one of those user profiles, the referrer, the referee, the scheduler, the doula, everyone who's engaged in that equally has front ends that are also interacting with SurveyVista. So we're using it across the continuum, if you will, of care
mm,
and management for our clients.
mm. Yeah, I think you've highlighted something really beautiful, which is that at every sort of step of this customer journey, or in this case, a patient journey, there's opportunity to use this tool to basically create this sort of like two-way street of communication. I'm giving you my information. Here's the situation I'm in. You're alerting all of your team to that this is the patient. They're then able to then use the tool to move my application process through these internal systems. And then let's say I go through this process, you can then ultimately at the end collect the feedback of how did that go. So at every one of these customer interactions, there's an opportunity to implement or improve that process by partnering with technology, in this case with SurveyVista, which I think is so fascinating. I have no doubts, as you said earlier, you'll find a way to get this into the finance team. Just your
Thank
ability to
you.
maximize the tool, I think, is really commendable. I think
Mhm.
one of the things I'm a little bit curious about, and Nargees, I'm going to direct this to you, is sort of like what were some of those challenges? I know there were some tools in place before SurveyVista, and so I guess I'm wondering like what some of those challenges were that you had with those initial tools, and what sort of SurveyVista has done to alleviate any of those challenges, if any.
Okay, yeah, thank you for asking that, Chase. So like Fran said, we do have a business process in our organization, which is very crucial for us actually. Like Fran mentioned that we do get fundings from there. So
Mm,
most of the important process is actually we have leads and converted clients, and we do have a lot of forms, different forms submitted. Either they will be attached to lead or client. So, and when earlier we were using the other tools to submit, so there was an option for the user to just toggle a button or like checkbox the button to if you want to update this form later. So what used to happen was like our users forget that. So what happened is like there were so many manual errors. Like, you know, sometimes people do spelling mistakes, simple thing, right? Typographic errors. So that used to become like very hassle for us to track because they used to create a new record instead of updating. So that is why actually Fran was more concerned about changing a tool. Then, as we suggested, SurveyVista, because we were using it earlier also. And then that made actually like, you know, great efficiency in CRM. So that is the biggest challenge we had it when we were using previous tool, and now it makes our life much easier with SurveyVista.
Yeah.
Mhm.
Yeah, I love that.
Oh
I
my
think
gosh,
it's
can I jump in on that for a second?
yeah,
Just
Franco.
to like,
Yes, Fran,
and
please.
Nargis, when you said that, it made me go back to remembering that's an element of one of the things people like just they just dread when they're filling out, when they're having their charting, is that to have to put all the information back in, not just the clients in like the client's first name, last name, from a back end perspective, that creates for dirty data, right? Because like, there's people are spelling names inconsistently, all this kind of stuff. But then added to that, there are other data points that we also are collecting that are redundant. It's like, can we not have to keep entering the same? And every time we have to enter data in, we expose ourselves, right? We're creating an opportunity for data to be compromised, to become, to not be valid, right? Have inconsistencies. And that was one of the things that I loved that Nargis that you were able to do with this tool was to figure out a way to literally for some of our forms, you've taken the burden out of over a third of what would have had to have been entered just by being able to pull data back in and be able to show that. And I don't know if there's a more technical way that you maybe want to explain that to everybody, but that's been really huge for us.
True, Fran.
Yeah, I think one of the things that I'm hearing here is like the ability to have your sort of like form be more intelligent or be more connected to the existing data set means that you don't have to always collect the same pieces of information. To be able to say, oh, I already know that this is Chase and he lives in this environment and these are his needs. So I don't have to ask him that every single time that we go through the process. The ability to have your form tool or your data collection tool more integrated with Salesforce where this data lives means that you can cut down on the amount of data that you have to capture and also reduce this sort of problem which a lot of people have, which is that, there's a high likelihood of duplication or dirty data, as Fran mentioned. So the ability to have your form be more connected to the existing environment allows you to have sort of this deliver a better user experience.
Mm-hmm. And not just for the internal. One of the ways that we do this is so, for example, again, doulas actually engage in what's called a birth planning session with their expectant families. And the birth plan, like everybody loves a birth plan, right? Not that they necessarily, they do, they love the birth plan. They're excited about that because that's like getting prepared for the big day. And of course, I always warn them, you're going to be prepared to throw it out the window because life's what's happening when we're busy making plans, right? Good
Yeah,
John Lennon
love
quote,
that.
right? But the point is that when they come, we send it to them. So the form is sent to the client to complete the birth plan. And then they have a birth planning session. And when they sit down with us for that session, we go in and open that same form with them and dynamically are able to see all their responses and in
Mhm.
in real time make changes because they might have selected something that they really didn't understand. And as we're going through the form and we describe it to them, they're like, oh, well, no, I didn't want that. Or, oh, yes, I really do want that. And so we're able to make those real-time changes for the client, save those back into the tool. It's in real time updating into Salesforce and generating a beautiful laid out PDF and sending that off to the client. And then on the day of their laboring and they head it to the hospital, they're able to present the doula and the client present the printed birth plan and provide that to the clinical staff. That's huge. Now, it sounds like simple elements, but it's not just about the technical aspect, it's also about the business aspect. There's an efficiency that happens for us. Majority of folks are doing these processes on paper or they're recreating them. And you can't, I guess I would estimate usually a birth planning session can take to 90 minutes. We're able to cut that time down literally to 2/3 down to an hour because of the way that we are approaching the use of the tool and the way that we're enabling our clients to directly interface with the tool alongside us.
Wow. So you're able to provide better faster, more agile experience simply by having a better form tool. So this is where I think it's so interesting, because it's sort of like, well, what is the value of a form tool? Well, it actually comes to these really specific operational outcomes, these really specific customer outcomes by having a better technology in place, which you may not think about as you're in that sort of initial wash of evaluating 1,000 tools that Fran was talking about, which it wasn't exhaustive, but it was certainly exhausting. And then sort of to think about, well, you're driving towards some pretty big potential outcomes here, which I think is really interesting. One of the things and Nargees, I'm going to direct this towards you as sort of our technical person, but one of the things I can imagine people are thinking right now is like, this sounds really great. It sounds like it could also be really complicated for me to build all of this out. So do you want to talk a little bit sort of about what the implementation process was like? Did you work with our team at all through that process? Sort of what was it like doing those initial build outs?
Yes, Chase. Yeah, all this is whatever Fran and explaining. This wouldn't have possible without the SurveyVista's greatest feature. I can say one of the greatest feature, which is Salesforce data type question. This made possible through that. So I'm going to give you like an example that a workflow we implemented with SurveyVista is by integrating Salesforce. We used this SurveyVista Salesforce data type question, where actually in the first page, user can just search for existing lead using identifier like just full name and a date of birth. So when they click next, actually, the form which they need to submit, which opens up pre-populated with their first name, last name, and date of birth, which is very unique fields in our organization. So that means no errors. We pulled up our lead. Now we are going to enter all the data the user needed, and then, we submit the form. And another feature, SurveyVista has that link record feature, which is very great, I believe, because it connects to that submitted form based on some criteria or some condition, whether the form should link it to lead or a converted lead or any other object in Salesforce. It's all defined through that link record option in SurveyVista. So once that submit, that get linked to the object in Salesforce, and then once it's submitted, like later sometime the user want to just update it, like Fran said, they don't have to open up the form and enter all the data. They just need, again, same thing, like they look for the lead, and then it pulls up the previously submitted form for that lead or client with all the dynamically populates all the data. So the user can see what was submitted before, and if they want to change just one or two particular fields, they just do modification submit. It just updates the existing record. This is very great, and this is like like made our employees or our organizations work process very easy, seamless, I can say. Okay.
Yeah.
This is the very nice streamlining the process using the SurveyVista and Salesforce integration. Yes.
Yeah, it sounds like in some ways you've sort of like, you wouldn't let a user log into your Salesforce environment and make their own updates, but by using this SurveyVista tool, you sort of are enabling that same process where they're able to look up what you have on file, make changes if they need to make changes, make updates if they need to make updates. And it sounds like that's happening for potentially multiple different objects in Salesforce, not just the lead or contact record, but also any of these custom records that you have as well, which I think to Fran's point really sort of enables less of this charting, less of this burnout by allowing the end user to do more of the updating and not having to create new records all the time. It drives better data in the CRM, better behaviors, better customer efficiency, all those types of things.
Yes, Chase, because you know what, like not all of our users are internal. We do have external users also, right? So that is why we kept everything is for external users, and we rely on SurveyVista so that there are no errors, right? If a user go log into Salesforce, if by mistake they've done something like a mistake, they've done something wrong they're not supposed to, so the data will be like mistakenly, right? So that is why we generally don't give them this one, and we use like external users only.
Yeah, got it. Got it.
Yeah.
Okay, well, I guess we've talked about a lot of things. Driving operational efficiency, which I love that term, which we stole from Fran and put it in the webinar title. We've talked about how this Salesforce integration has really enabled this two-way communication. I guess I'd be a little curious, sort of like, what is next for the Reach Healthcare team, particularly in terms of like this SurveyVista use case. It sounds like this is an ongoing effort to find more and more ways to use this tool. We've talked about a few key ones and a couple of these cool workflows that we have so far. I guess I'd be curious, sort of like, what's the next chapter going to look like?
Yeah, that's a really great question. Well, I can tell you it's a bright future. You know, as we're starting to mature in our use of the platform, I just, I want to throw it back though as just a little word of caution, right? Because I guess I have myself been in the digital health space a really long time, and sometimes people get shiny object syndrome. So this isn't about us having a tool and then finding a problem. This is us having problems and going back to, well, what do we have that can help us with these problems internally? And there's a really big distinction there. So with that, as I kind of think about the future and where we're going, there's a couple of different areas that are exciting to me. One of them is in relation to our our training and our education. So we're doing a lot of work right now in the education space. We just launched our childbirth education programs, and that's been excited. That's very much community focus and community facing, as well as I feel as though we have a talent management system, but it really houses content where we have to build our own lessons, and along with that, our own assessment tools. And so I'm really excited about this notion of being able to incorporate all of that utilizing Salesforce. That's going to be exciting. So that's a really very big area for us. And I'm going to pause for a second on that too, and just to embellish, because particularly, I guess, when it comes to the childbirth education side, right now, the platforms that we're using, we love them, but they're costly to us. And so we have to find a way to drive down some of the costs in the current system. And in order for us to be able to do that, we need to start to look at what can we internally be able to to develop and curate on our own. And
Right.
so this is where, again, we have to say, okay, well, what tools are at our disposal to make this happen? One of the examples that I've been recently learning about is, for example, integrating video content. So, okay, that's exciting that we can create these, we don't have, you don't have to have everything in separate environments in order for us to present to our learners information, because sometimes that creates challenges with their ability. It actually can hinder their ability to learn, as well as it could potentially create situations where there's no follow through, which is what we actually see with our talent management tool at times. People going in, they do one part of a learning, and they don't finish it out, or they don't complete the assessments. So to be able to create that, have that integrated element, we're really excited about that. I don't know if either Chase or if you have any questions on that, or Nargees, if you want to make any comment before I give another example, but that's a big one for us.
I don't think I have questions on that. I mean, I think that I'm just always fascinated by your ability to find new solutions to use SurveyVista. So I think that's great. Keep going. We want to hear about all the new ways you want to use this.
Yeah, another one for us is on is the reporting element. I'm thinking that, it's interesting. We tend to be a little didactic when it comes to analysis of data. Like, for example, someone can present a dashboard of information, while there's all kinds of conversation that might happen outside of that dashboard, outside of those analytics, if we utilize SurveyVista, I could see potentially the opportunity to create for a more dynamic capturing of information, because we could actually incorporate, right, the analytics, the data points that are coming, and draw in and get more feedback from those who are participating in analysis. You know, one simple example of this is like right now I have, you know, some of our staff is focused on, they have these goals on outputs, things they have to deliver. And all I really need is to know, like, okay, well, you know, their productivity levels, like how much have they presented? And I'd love to be able for there to be a dynamic way of integrating those performance measures into an environment, an interface, where then in turn they could also be asked a series of questions based on their ability to hit those targets, but be able to present in a way it's dynamic so that it's reportable in me in a way that I'm a storyteller and I like stories where I can see instantly. So for example, you know, today someone didn't hit their numbers, their goals for the week. And I'm like, well, why didn't you hit your numbers? And the conversation around that, I probably could have cut down the time in having that conversation if those quantifiable points had been pulled into the tool and those numbers are available and put, and I know this now because Nargees is teaching me about how the tool can be used, that I could pull those data, those aggregate data points into SurveyVista along with information for them to share with me what's going on if they didn't hit they didn't hit their numbers today. Right. So I don't know what the word is for that. I call it dynamic or interactive dashboarding, you know, so that I'm able to get in real time. And why that matters is because we're a very lean organization. And if I'm doing my best to have 30-minute check-ins with literally a dozen staff members in a week, and I can't afford more than I want to afford, but I can't afford more than 30 minutes. It has to be that conversation that we're having has to be, you know, it has to be very efficient, right? Very good use of that time. I only have 30 minutes to spend with them. So if I could have this platform, which again, I think it's very capable of doing now that I've seen other ways that we've been able to use it, to pull that data in and create for that dynamic. I already have that information. So when we go into that conversation, not only are they prepared, but I'm prepared. And then we're just going on and talking about refinements that we need to make. Like in the case this morning, in fact, which is a repeated case I've had over time, has been, well, let's look at your workloads. Let's make these modifications. But those insights, I think that's the key. Sometimes people think that a tool like SurveyVista, that the insights that can be derived is only from the outside. In other words, you put data into SurveyVista, and in order to get the insights, you generate reports, something outside of the tool. But in reality, you have the opportunity to use the tool to not only output insights, but also bring insights directly into it so that the tool itself becomes a point of information. I don't know, that's a little wordy, but I hope that it makes sense, because that's one of the things that I'm thinking about. And I know Nargees is probably like, oh my gosh, what? Because I keep coming up with ideas. And she's probably bracing herself because it's something that I want to be able to do in the new year to even further propel our ability to, you know, to improve productivity.
Yeah, I think what's so fascinating is just like this idea that I really love this idea that if the data exists in Salesforce, you can increase the context you have around that data by presenting it in the form of this survey, right? Like we don't have to ask you, why didn't you hit your number? If you tell me that before I get to the meeting, I can then come and help you prepare for that or work around that or come up with some sort of solution for that moving forward. And you may find nobody hit their number this week because they all had the same exact problem, which would be hard to quantify through a series of 30-minute meetings. You're bouncing around, you may not be able to link all those pieces of data together, but by grabbing the context from these users beforehand, now you can quantify the unquantifiable, as it were.
Exactly, that's exactly right. And of course, there's a many more, but the last one I just want to maybe highlight today, because you know we only have so much time for this call, or this webinar. is around our contracts. We're trying to figure out ways to simplify the contract process. We're looking into that. We know that, you know, SurveyVista has a huge roadmap of its own. And quite frankly, if you had to ask me what was one of the defining moments in making the decision, there were two. It was number one, you know, like Narja said, that the problem that we had, they were able to demonstrate a way to fix it. But it was a way in which they demonstrated it. You know, that we were able to easily reach out and get answers to the problems we were having, and that they took the time to follow up. When I was at Dreamforce this time around, it was really nice to see you guys were there and that you were showcasing some of the new features and of your roadmap. That then starts to, you know, inspire me and give me more ideas. But I also came to Dreamforce. Quite frankly, I think I had, Nargis, what was it, 24 hours at Dreamforce? I was in and out, right? Wasn't that right? I literally,
Yes.
I was in and out. And when I got there, I had my list of things that I wanted to go through. And the team took the time, SurveyVista team took the time to sit down and go through that list with us and start to figure out ways. And you know what? Do they have the answers to everything right then and there? No. But the fact that we've been working with the developers and, you know, there's been this open dialogue. I am you know, I'm a collaborator, but I'm a collaborative. I believe in collaborative leadership, and to be able to collaborate with the SurveyVista team and directly with the developers has made a huge difference. And so I'm excited about what we'll be able to do with contracting, but also excited about, you know, all the things that are on the horizon with SurveyVista itself. Because we're just, you know, we just see so many ways that it can really help to revolutionize the way that we operate.
Hmm. Yeah,
Okay.
that's really wonderful, Fran. I appreciate you sharing sort of that collaboration piece and looking for less of a piece of technology and more of sort of a partnership. I think that that speaks a lot to the relationship that we've built. And I think for the sake of time, I'm
Chase,
gonna,
just
yeah,
sorry to
Nargis, go for it.
interrupt you. Chase,
Yeah,
sorry to interrupt you. Just I have like 30, I'll just take 30 seconds or so.
yeah,
Yeah,
go.
when I said, yeah, I really want to talk about your support team though. Your knowledge base, the document is very good. It's very clear. If I have it doubt on how to process, how to configure something, I can go there and see. But like I said, when I was using Salesforce data question type, which was easy because it is in the knowledge base, but I did have some like, you know, troubles because I'm not aware of some things. Then support team was in like, you know, they were very helpful. SurveyVista support team will get all the 100 stars, I can say. They are very great. They are very patient, like, you know, very helpful. And they will check whether if we solved our issue or not by sending email, by contacting them. So really, really, I mean, I'm so grateful to them. Actually, I like, you know, I do end up in some issues but they are there for us. The Service team always there. So
No, that's so nice to hear. I appreciate you interrupting me and sharing that. That's so nice. Thank you for saying that.
yeah.
I'm sure the support team will love to hear that. I'm going to maybe move us along a little bit here and talk about why people choose SurveyVista. And this has been highlighted by Fran and Nargis throughout the sort of entirety of this presentation, but there's a couple reasons why people tend to choose us over and over again. The fact that the platform is really easy to use is sort of table stakes. You got to have an easy to use interface. You got to be really flexible to enable all of these different sort of use cases that Fran's mentioning. The fact that we can scale across the organization means that we can deliver a lot of value, and it means that we can deliver a lot of insights. This ability to get your data inside Salesforce to then be able to look for trends and patterns with your customer feedback data side by side against all of your customer data really takes your feedback program to the next level. One thing that we didn't quite hit on is this idea of it's an incredibly secure tool. We're a native application, which Fran did mention, but one of the reasons that's important is because your customer data is now never going to leave the confines of your CRM. So when you are capturing data, in this case, maybe there's some HIPAA data, there may be some compliance needs. The fact that you can do all of that in this tool is really great. And then, you know, I love this idea that the pricing is affordable, but more than that, it means we deliver outsized value. compared to the investment. And the ability to scale across the organization and collect unlimited amounts of feedback and support a wide range of different teams means that your investment in SurveyVista goes a long way in delivering on your goals of customer transformation or digital transformation or customer efficiency. Whatever your goals are, we can really help deliver that quickly with our scalable model. And then, as Nargees was just pointing out, a lot of people tell us that our support team is really incredible. If you go on the App Exchange and you look at any of our reviews, and we have I think we have over 130 of them right now. Most of them are 5 stars. We've got a 4.9 rating. But one of my favorite exercises, if you go to the review section and you control find support team, it's in every other comment. If not, you can't read more than 2 comments in a row where people aren't mentioning that. So if you haven't already, you can check that out. But I think one of the things that people really love about our product is that we also have this methodology that helps you gather a lot of the value very quickly. Not everybody is a survey expert. And so what we can provide is both technology and methodology. And we have this really quick 4-step process to building a customer feedback program: collect, integrate, understand, and act. And that gives you a really easy framework to be able to get up and running quickly, know that you're implementing best practices, and we can deliver all of this value at all of these different key interactions. I'm going to, in the very limited time that we have left, only because I promised it, I am going to give us just a sneak peek inside of the actual application. And if I share my screen here, I'm inside Salesforce. You'll see we are a Salesforce app, so we live in the sort of app launcher here. And one of the things I wanted to just give a quick visual on is the fact that we keep talking about supporting different use cases, but what does that actually mean? It means that the tool is really flexible. The survey builder is really flexible. I've got this example here from Nissan. This is a 6 to 7 question survey. Looks like a traditional survey. And I'm going to click through here 1 question at a time. That looks very different to me than this Nexo Pro example, where this is a literal 3-question survey. And they do 1 question at a time, but I just get sort of moved through the process automatically. They're using custom background images. It's really engaging. For Fran and the team, they have a lot of surveys that look much more like this, which is the equivalent of a digital form. And you can collect all kinds of information. You can see this form is longer, so I've got this little runway at the top that'll walk me through the process. But the ability to have a really dynamic survey builder means that we can support all these different use cases. And I can give my consent and I can give my signature, and we can even capture payment through this process if there was a need to do that as well. So the ability to support a wide variety of use cases starts with a really easy to use tool with a really flexible survey builder, ultimately. And again, as the team was mentioning, a lot of the value comes back to the Salesforce integration. I'm now back inside Salesforce. I'm looking at a contact record. I've got some custom fields here that'll house my customer feedback data. Or the way that the Reach Healthcare team is using this is I come into the system, I fill out a form, and now my name, my title, my department, all of the information that they need about me to qualify that lead is captured and automatically brought into the system. Then they're doing some really advanced things where they let me actually update that as I move through the process through these Salesforce data type questions. But ultimately, the data all lives inside Salesforce, which means I can dashboard this side by side against all of my customer data. So I could look at what my customer satisfaction score is and segment that by the case type, the account type. In the case of Reach Healthcare, they may want to know, when we conduct this class, when we conduct this digital learning, are we getting better scores when one doula presents versus another? Are we getting better scores when someone's in person versus when they're on digital? So you're able to break down all of your customer feedback by all of your other customer data that lives inside Salesforce. And that means that you can use all of the great Salesforce tools, these dashboards, the AI, all of the stuff that Salesforce is investing in now applies to your customer feedback program as well, because all of your data is going to ultimately reside here back inside the system. So this is getting to that sort of like understanding part of the process. The last piece would be the ability to, act on all of this feedback. And so there may be times where you're getting low scores. And I think there's an example in here somewhere where if we get low scores, we can create a case record or we could create a task record for somebody to follow up with. So this contact's given us generally high feedback. We might want to route that piece of feedback to a marketing team, say, hey, go and follow up with this person and do a case study. Or in the case of feedback on a particular class, you might want to alert the doula or alert the learner or alert the person who's conducting that class. Hey, here's the feedback that you're receiving from the class itself. So the ability to take this data, and yes, we can get it in Salesforce, and yes, you can dashboard it, and that's sort of like a static look at the data. It can also be really dynamic by implementing all of these different acting options, whether you need to alert somebody via email, you need to create a case inside of Salesforce, create a task for somebody to follow up with. So that end-to-end process, if we go back to our little view here, the end-to-end process across the customer feedback lifecycle, from a really flexible builder in this collect phase, seamless integrations into Salesforce, mapping to any object, standard or custom, the ability to dashboard and get that into this understand phase. And then the last piece, which is critical, is ultimately acting on this feedback in a timely manner. All of that gets supported by the tool. And again, we give you sort of this out-of-the-box methodology to make sure that you're setting everything up correctly. I think that we are just about out of time. We may take one question here. If anybody's got questions, they can throw them in the little Q&A, or they can find us in the chat as well. But I think, Fran, one of the things that I'm interested in hearing before we let everybody go, and if there are additional questions we don't get time for, we'll obviously follow up with everybody one-to-one. But Fran, I'm curious from your perspective, there's a lot of people who are going to be watching this who are sort of evaluating customer feedback tools, maybe evaluating SurveyVista directly. But I'd be curious, like, what advice would you give to somebody who's in that position that you were in all those months and years ago, when it was this exhausting process of looking for feedback tools? What advice would you give to somebody who's in that position?
I think the biggest thing that I would encourage them to do is to take a step back and understand what it is first and foremost they're trying to accomplish. And I think that, you know, we might say, oh, yeah, you know, well, I just want to have, I want to be able to collect information from my user base. Well, that's legitimate, but why? Right? Why are you trying to collect that? What are the goals that are centered around that? And I think that was the thing that kind of drove us to be able to say, wow, this tool could do so much more. And I want to, you know, let it be known, our journey with SurveyVista is still a young one, right? We didn't implement this. I wish I'd had Nargees and had had this tool years ago.
Yeah.
I do, but we've only been on this journey, I think, about a year now. So it's, Nargees, do you want to add to that?
Yeah, because yes, Fran, thanks. I mean, my advice is like, you know, what myself think is like, most of the people think SurveyVista or any other, SurveyVista as a just for surveys only, but this is actually beyond to that, I believe. And Reach Healthcare collaborating with SurveyVista, actually we proved that we can use SurveyVista surveys in kind of like, you know, different approaches, different ways we can use it. So this is not just for surveys, I feel. So think like that. Think beyond surveys. Yeah.
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 Beyond the surveys. Yeah. People in process, right? Think about the people in the process beyond the survey.
Yeah. All right, I love that. I think we are just about out of time. I think I just saw my clock go to 11, so we really nailed it. If anybody has additional questions that we didn't get answered, you can reach out to our team at info@surveyvista.com. You can also find us on the website and book meetings with our team directly there. Fran, Nargees, so grateful for you for coming on and spending the time here with us and sharing the story. This was really incredible.
Thank you so much, James, for having
Yeah.
us, actually. Yeah, we are happy to be part of it. Thank you.
Yeah, awesome. Well, thanks everyone. Again, reach out to the team if you have any questions. We'll also be following up with a link to the recording and any unanswered questions that we didn't get into. But for now, we're going to end the webinar, and we'll look forward to seeing you guys on the next one. Thanks again to the Reach Healthcare team.
Thank you. Thank you so much.
Thanks, guys.
Thank you.
Take care.
Thank you.
Bye.